Hello and welcome again to the BLT System. I am Dr. John Larson. I'm the creator of the BLT System. And this is the BLT System Basic Training video number 2. In this video we're going to talk about the logic of a holistic provider doing a functional blood lab testing service in the care of your patients or clients, and just kind of talk about a little bit more about the big picture of why this even makes sense. So what's interesting about taking this training seminar that I normally do in front of a group of doctors and healthcare providers and break it down into a series of shorter videos is that what you're looking at right now is normally the starting point when I begin doing this training seminar. So if you've already watched the introduction video and the basic training video number 1, you're already starting to get a pretty good idea of what you can be doing with the BLT system in terms of easily ordering the blood lab testing in a way that's going to be inexpensive for the patient to do, as well as how easy it can be to create a really nice looking lab report that does that critical or more functional interpretation of the lab results for you and puts it in a nice color-coded format. So it's very easy for the patient as well as you as a provider to see what's working well, what's not working well, to more quickly create recommendations. And I can tell you, again from experience, that having that kind of a visual is very, very powerful. So for almost all patients to have a really good visual is extremely powerful in helping them to understand that a problem really does exist, and they're going to be much more motivated to want to follow your recommendations. So let's get started. I call this a training seminar because training implies that you're actively doing something as you're learning. So it's different than sitting in a room and listening to a seminar and just kind of sitting and absorbing, kind of being a sponge to absorb information or as much as you can during a seminar. In this training, you're going to be asked to actively be doing some things to help you to learn this process much better. I think people actually learn best by doing an activity rather than just talking about it. And this makes me think of another interesting point or another interesting barrier. Sometimes that's communicated from providers that will learn the BLT system. I will sometimes hear from them that they feel like they just need to learn more before getting in and starting to do the lab testing. And I certainly respect that idea of wanting to acquire more and more knowledge. But in reality, there comes a time where you need to move beyond talking about it and get into the action of doing it. And it is my belief that it is the action of doing something is when you will learn it the fastest and learn it in the most effective way. As an example, let's say if you're going to school and you're training to become a chiropractic doctor or an acupuncturist or an acupuncture doctor or even a massage therapist, or I could list other professions as well. You just have to get beyond the point of talking about it, and really it's not until you get to the action of doing it and doing the treatment and doing the therapy and doing the process, this is when you start to understand it the best, and this is when you learn it the fastest. And it really is no different when it comes to the blood lab testing. Understand that doing blood lab testing and doing the functional interpretation, it doesn't really come natural to anyone. It's a learned process. So if this is something that you want to be doing in your patient care and in the care of your clients, your smartest option is to just get to the action of doing it and know that in the process of doing it, you will learn how to do the interpretation the fastest, you will learn how to create the recommendations the fastest, you will learn how to explain the lab results and your recommendations to your patient or client in the shortest, most effective, smartest way possible. And all the while you are beginning using the BLT system, you always have a backup, which is getting in contact with me if you have any questions or concerns about anything related to the process. You're always welcome to call me, and essentially I'm there to back you up. So please don't hesitate to call me or email me anytime with questions or concerns. I'm actually expecting that as each provider gets started out using the BLT system, I'm expecting that you're going to be contacting me more often. So in these videos, we're going to move beyond just talking, and you'll be doing some of the work and some of the activity involved in a functional blood lab testing process. So this training is designed to be interactive. I will recommend that you are creating the lab reports as we go over some different examples. You will have the ability to go into your own account and create the lab reports along with me. And we'll be talking together over this video, helping you kind of brainstorm and think about how it is that you want to prioritize the recommendations. and please ask lots and lots of questions. And so in a video format like this, it's a little bit more challenging as opposed to sitting in a room and me doing the presentation. But what you can do as you are going through these videos, I strongly recommend that you have a sheet of paper there, and as questions come to your mind, you start writing down those questions. And as you go through the videos, if you have certain questions that are not getting answered, then those are the kinds of questions that you want to send me an email or give me a call, and I'll be very, very happy to go over any of those questions with you. So when did I actually start doing lab testing? I thought it might be helpful for you to understand a little bit of my background and what led up to me creating the BLT system and getting so involved in this functional blood lab testing process. My original professional degree is as a doctor of chiropractic, which I earned in 1997. When I first got out into private practice, instead of promoting the fact that I was a chiropractic doctor and I could offer chiropractic care, I instead chose to promote my ability to help people with weight loss. My comfort level was very high in helping people when it comes to weight loss. I had worked as a personal fitness trainer prior to being a doctor. I've already been in that environment and felt really confident in my ability to help people with their challenges when it comes to weight loss. But it became clear to me early on the kinds of people that were coming to see me were different than the people I was working with when I was working as a personal fitness trainer prior to being a doctor. Typically, the people that were coming to see me had felt as though they had already tried every single kind of diet that they could think of, as well as any way of exercising. So it became clear early on that these were people that there was something else going on in their body chemistry that was out of balance, that was slowing down their metabolism, that was becoming part of the barrier as to why they're having difficulty losing weight. So very early on, within my first year of practice, I had to get very good at doing a detailed and accurate testing of thyroid function. And not too long after that, it became obvious to me that for some of the women that I was working with, I had to get very good at doing a detailed and accurate testing of the balance of female hormones. And then from there, my interest in doing different kinds of testing just expanded to measuring more and more different things within body chemistry. Eventually I became board certified in clinical nutrition, and all this time over the years of helping people with doing different kinds of lab testing, I had also been using several different kinds of lab reporting softwares to help me in the interpretation of those lab results. And there are things that I liked about all of them, but none of them had the flexibility for me to be able to edit or modify or change the information within the report the way that I wanted to. So that gave me the idea of creating a lab reporting software initially just for myself in my own interpretation of lab results for my own patients and clients. So I created the design of the format of what I'm looking for. I hired a computer software type person to take my idea and put it into a computer format to look and work and function the way I wanted it to. And I was using this for a while, and it was working quite well for me, and I shared this with some other providers and they liked it as well. So then I decided to take the leap and have the whole system essentially redesigned so that it could be used by any healthcare provider who was also interested in doing a functional blood lab testing process in the care of their patients or clients. So this is how the BLT system essentially came about. It's something that continues to evolve and just keeps getting better and better, making the process faster and easier, and has become a really, really good tool for the providers who are using it. And I think as you learn more and more about the BLT system and go through the training, you will see just how useful this will be and how much time it's going to save you. So what other nutrition type testing or evaluation methods have I done over time? I want to show you this diagram. I want to give you a good understanding of kind of my process when I have a brand new patient or client come to me and I do the initial consultation to find out what exactly are their symptoms or concerns. And usually one of the first questions I ask them is, when you think about your body and how it feels and how it's functioning, of everything going on, what really is the number one thing that concerns or bothers you the most? So they'll tell me what that is, and I'll ask some more questions to get information, and then I'll say, well, what is the next thing? And then the next thing, and I'll get a list of 3, 5, 8 items, whatever is going on for that person. But I like to ask them their priority so I understand what's most important to them. And when I get around to deciding how do I want to investigate what's going on with this person, I have what I call my baseline investigation. And then from there I have other kinds of specialty testing that I'll look at. So I want to go over this with you to start to give you a picture in your mind of how you might want to start thinking about how you're doing these investigations into body chemistry. especially if this is something that is fairly new or maybe brand new to you. So as you can see in this picture here, my baseline investigation almost always starts out with doing a couple sets of questionnaires. So one of them is your basic personal health history, family history type questionnaire, and the other one is a symptom survey. The kind of symptom survey doesn't really matter. There are many good symptom surveys that are available from different nutrition companies or different resources, so it's whatever one that is convenient, you have easy access to, whatever one you like is fine. The second item in my baseline investigation is I will almost always do what's called a heavy metal screening test. And I'll explain to the patient that with this heavy metal screening test, we're testing for the level of toxicity within the body, specifically for heavy metal toxins. And the way that I'll explain to a patient or client the benefit of doing this is I will say to them, when you think about all the different chemicals and toxins that most, if not all of us, are exposed to over our lifetime, it's the heavy metal toxins that are among the most damaging to the brain and nervous system, as well as disruptive to the hormone systems. So as a doctor, as a provider, I want to know if this is part of your health picture, if the presence of these heavy metal toxins are within your body causing this disruption, maybe even damage to your cells and tissues. Because if this screening test comes back positive, this becomes an early priority to work on getting this toxicity out of the body. So this heavy metal screening test, I find, is something that not a lot of providers have heard of. And one of the reasons why I like this is because it's quite an inexpensive screening test, but at the same time, it's really, I have found it to be quite a sensitive indicator as to the presence of toxic heavy metals. So the company that I purchased this from, the name of the company is called Nissen Medica, and they're spelled Nissen, then Medica, Medica. They're a company based out of Canada. And I actually have their contact information here, so let me just go out of this and let me open up this here. So here you go, Nissen Medica. If you want to write down this contact information, I would say just go ahead and click the pause button on the video that you're watching right now, and that'll give you a chance to write this down. Here's the phone number, there's the website, here is the email, which is info@nissenmedica.com. Well, this company is located in Canada, and it's a part of Canada that is primarily a French-speaking part, so when the person answers, you can tell there'll probably be a fairly thick French-type accent. And that when you call them, they'll be more than happy to set up an account with you, but you'll want to actually give them my name of Dr. John Larson. Just tell them that you heard about the heavy metal screening test from Dr. John Larson, who's in Minnesota, and you're interested in setting up an account so you can start ordering the heavy metal screening test. And just so you know, I don't get any personal benefit by you mentioning my name. What has happened is they used to market their heavy metal screening tests more aggressively within the United States. Well, then the FDA came in and said, well, we're not so sure we want you to be saying some of the things that you're saying. So they kind of pulled pretty much most, if not all, their marketing out of the United States. They will still sell to providers in the United States, but they're just being a little bit more selective. And then the heavy metal screening test, it's called the HMT1. It's actually item number, here you see item number 110. So this is exactly what I order, and this is how I do it. Once I have an account set up, they have my credit card on file, and I just send them an email saying this is what I need, and they say great, we'll charge it and ship it out to you, and you get it usually within a week or so. Very simple. So what exactly is this heavy metal screening test, and how does it work? Basically, it's a small box kit that the patient will purchase, and what I do is I have them take it home and I provide them with a detailed set of instructions, and I will provide for you this packet of instructions as well. Let's take a look at that. So the instructions that I've created for the heavy metal screening test are more detailed and I think easier for a patient or a client to utilize than what they find in the box. So the box will come with a set of instructions. I actually just take that out and throw it away, and I will email or provide these instructions to my own patient. So they can read through this, and what a person is doing in the convenience of their own home is they are gathering a small sample of their own urine, and they're taking this and they're introducing a 1 milliliter at a time into a test tube that has a solution or a reagent in the bottom. And the change that we're looking for as an indicator for the presence of toxic heavy metals is a color change. So on this fourth page of the instruction, it shows the color changes that can occur, and it actually shows you the 6 items of what it's testing for. It's testing for cadmium, lead, mercury, nickel, copper, and zinc. So of course copper and zinc are trace minerals, but when they get at too high of levels, they start to have a toxic effect on the body. So for a screening test, I have found this to be a very sensitive indicator for the presence of toxic heavy metals. I've even done the screening test and what we would think of as more the gold standard for testing for toxic heavy metals on the same person. What that gold standard would be what we call a provocation challenge, where a person is initially gathering a urine sample, then they take a chelation substance as a provoking agent such as EDTA or DMSA or some other substance to try to pull these toxic metals out of the tissues and get it back into the bloodstream. And then you do a post or after urine sample to see what is in the body or what kinds of toxic elements are getting pulled out of the body. And with doing the heavy metal screening test and the more expensive lab testing of heavy metals on the same person, I found that the heavy metal screening test was still a very, very sensitive indicator. So just so you understand, based on my own experience, my comfort level is very high in using only a screening test to identify the presence of toxic heavy metals or to get an indicator. Certainly you can't diagnose this off a screening test like this, but it's a good enough of an indicator for me that I feel very comfortable using it that way. However, you need to do what is within your own comfort level. So if it's within your comfort level to only do more the gold standard lab testing, then definitely do it that way. I think no matter what, it's important that you're doing some measure for these toxic elements within a person's body, because the toxic heavy metals can be very damaging to the brain and nervous system and very disruptive to the hormone systems. You're talking about the 2 main control systems within the body, the nervous system and hormones. So if that's getting damaged or interfered or disrupted, that can lead to quite a significant domino effect down through the rest of the body. So when it comes to getting a person healthier, if we can get these toxic elements out of the body, this can be a quicker cleanup of the body chemistry and get things back on track a lot faster as well. So let's go back into the presentation. So again, my baseline investigation is doing a couple sets of questionnaires, the heavy metal screening test. If you have more questions on the heavy metal screening test, just call or email me. And then my third item that I will pretty much always do for my baseline investigation is the comprehensive blood lab testing panel as a way to measure what's going on with organ function as well as possible deficiencies within the body. So this is the comprehensive lab panel that we've already looked at a little bit in the first basic training video, as well as you may have seen in the video introduction for the BLT system. The reason why I like this comprehensive blood panel is we're looking at about 70 to 80 items all within a single round of testing, and I have found it gives so much and such valuable information about multiple systems all at one time. It's really a great tool to get a baseline on so many things at one time about what's going on within a person's body chemistry. So again, the baseline investigation is a couple sets of questionnaires, heavy metal screening test, comprehensive blood lab testing panel. So that's what I'm doing on almost everybody when I am first seeing them as a new patient. And then from there, I'm considering other kinds of specialty testing that may be appropriate for that patient or that client, to include things like a food allergy or sensitivity testing. The company that I currently use and have used for many years for food sensitivity testing is called the ALCAT test. So you could just go on the internet and type in ALCAT, and there certainly are other companies that you can choose from and that you can use. And again, it comes down to your comfort level of whatever company that you want to be using. I've used that company for my food sensitivity testing for many, many years, and I've been very pleased with the results that I see and the changes or the improvements that I see in the patients that I work with. And when it makes sense, I might do some more detailed female hormone testing. This can be done through blood or saliva. I used to only do the saliva testing, and I like the saliva testing because I feel it is a more accurate indicator of the free form of the hormone, which is what we're most interested in. But lately I've been doing a little bit more blood, primarily doing blood testing of the female hormones for those women that have already reached menopause, because in theory, once a woman goes into menopause, her hormone levels stay relatively the same over the course of the month, every month for the rest of their life. Whereas for a female who is still having a monthly cycle, we have different levels of hormones during different times of the monthly cycle, and that is where doing the saliva hormone testing for female hormones I find to be more useful. The company that I've used for a while is called Diagnos-Techs, so that's spelled Diagnos-Techs. They're actually one of the first companies to be doing the saliva testing. I believe they may have actually pioneered this type of testing for hormones as well, so they've been around for quite a long time. And there's certainly a lot of value for a lot of people to consider doing some adrenal function, adrenal hormone testing. As many of you know, all the different stresses that we experience in our lifetime can easily result in an altered or weakened function of the adrenals. And so for some people, when they're dealing with fatigue, inflammation, blood pressure, weakened immune function, so many things that can tie back into what's going on with the adrenals. So this could be really some valuable information to learn about the adrenals by doing some direct testing. For some patients, I might consider doing some micronutrient testing, and the company that I've used is SpectraCell. Their SpectraCell micronutrient test is probably what I would think of as the gold standard. It measures 40 to 50 or so of individual nutrients, from vitamins, minerals, amino acids to fatty acids. It's a great test to consider. And also for some people, I will consider doing the comprehensive digestive lab testing. Obviously for those people who that is one of their primary complaints, I will be thinking about more strongly about recommending that kind of testing. And this is by no means a all-inclusive list of the different kinds of specialty testing. These are probably some of the more common ones that I would consider doing. So again, my baseline investigation is doing a couple sets of questionnaires, heavy metal screening tests, comprehensive blood lab testing. I'm for sure doing that. And then whether it's right away or a little bit down the road, I might end up recommending some other kind of specialty testing to help complete the picture and allow me to be even more specific in my recommendations to help that person feel better and function better faster. So when you're looking for a nutrient deficiency or evaluating organ function, the comprehensive lab panel is really not the only way that we can evaluate for deficiency or for a problem with function. So let's take a look at 4 different evaluation methods, and let me ask you a hypothetical question. When comparing these 4 methods side by side, so we're looking at doing only a symptom questionnaire versus doing only some form of a muscle testing process versus doing only some kind of electrodermal screening, kind of biofeedback type technology versus doing blood testing. If you first remove yourself in your own way of thinking from this example or this question, and if you focus on how a brand new patient who is new to your office, basically walking in the doors for the first time, which evaluation method do you think that new patient would choose as being the most reliable or the most valuable? Which evaluation method do you think that patient is more likely to follow your recommendations and likely to want to do the follow-up testing with you as well? So when I ask this question as a group, the answer is the same every single time. It's the blood testing. The reason why the blood testing consistently is at the top of the list for what providers will say that a patient will put the most value in is because every person that walks through your door is already conditioned to understand that doing blood testing has a high value associated with it. They're already conditioned to understand that the blood testing is going to give them a lot of information. So you don't have the problem of trying to explain to them, trying to get them to understand the way muscle testing works or the way some kind of electrodermal screening works. They already know how blood testing works. They probably have already had it done. So it takes very little time to educate a patient or a potential new patient on the value of doing blood testing. They're already on board with the idea of blood testing as being a valuable and good indicator telling us what's going on inside their body. So let's take a look at this from another perspective. And looking at this graph, going up the side here, it's listing the percentage of people, meaning the percentage of people that are engaging or participating in a particular type of healthcare or healthcare modality. And the bottom part of the graph is over the course of time. Let's go ahead and start with regular or traditional medicine. So the very first school of medicine was the University of Pennsylvania School of Medicine, and this is in the United States, which started back in 1765. And so the question I want to pose to you is, in today's time, what percentage of people do you think participate or engage in some form of medical care? So when I ask this question of a group, consistently the group answers with quite a high percentage. And in fact, I will suggest that it's actually probably close to 100%. So when you think about over the course of a person's lifetime, from the time that they're born to possible medical or health issues over their lifetime or to their much elderly years, there's a very good chance that 100% of people in the United States, or at least close to that, so we're talking in the very upper 90-something% range, are at some point in time engaging in some type of medical care. And so in medical care, what is one of the main methods of evaluation? When a person goes to a medical provider and they say, I'm not feeling good, what is one of the most likely forms of investigation that that medical provider is going to do? Well, as you probably have already guessed, it's going to be doing blood testing. Now let's take a look at chiropractic care. So Palmer College of Chiropractic was started in 1897. So think about it, what percentage of people in the United States engage in some form of chiropractic care or chiropractic treatment over the course of their lifetime? And different references will state different percentages, but looking at multiple references, it tends to average around the 10 to 15% range. I did a little bit of research on this. Some were saying as low as 8%, some were saying a little bit higher, but it's kind of in the ballpark of 10 to 15% range. So when I look at this, I think about me as a chiropractor, this is fairly disappointing. I think about all the people that I've helped and all the different kinds of conditions I've been able to help people with. It's unfortunate that more people don't participate in chiropractic care. Let's also look at this from acupuncture perspective. So the first acupuncture school was the New England School of Acupuncture in 1975. So what percentage of people in the United States engage or participate in some form of acupuncture type care or treatment? In the research I did, it seemed to range in about the 5 to 10% range. I'm not so sure on the accuracy of the percentage on this one. It was a little bit harder to get information about this. It may actually be a little bit higher when you think about even chiropractic doctors that will do some forms of acupuncture. But the bottom line is looking at these more holistic or alternative, more natural kinds of methods, the percentages are really quite low. So what do you think is a way that we could get more people utilizing more holistic, natural forms of healthcare? And I will suggest to you that because every person that walks through your door is already conditioned by the medical system to think that blood lab testing has a very high value in terms of identifying what's working well or what's not working well within the body chemistry, if more holistic providers of all different kinds, whether it's chiropractic or acupuncture or naturopathic or health coaches or nutritionists or so on, if all of us had easier access to doing blood lab testing, we would have a larger percentage of the population coming to see us, because we can also offer to them a more critical or do this functional interpretation to better identify some of the patterns that other providers are not seeing with what's going on in their body chemistry. So the logic in a holistic provider to be offering a functional blood lab testing service is that it is going to, in time, attract more people to want to seek you for that specialty kind of a service. And if they come in through your door because they're looking for this more detailed kind of functional blood lab testing, it's more likely that they will then cross over and maybe participate in your chiropractic care or your acupuncture care or whatever other holistic modalities that you're offering. So I think in the big picture, the value in offering a functional blood lab testing service is this is going to help increase the percentage of people that are seeking out the service as a holistic providers, and this will create a better balance in terms of patient care or in the healthcare of the community between what can be done medically and what can be done more naturally or holistically, because right now the balance is very heavily weighted to typical or standard medical care. And there's no question that there are times when that's the type of care that a person needs to be seeking out. But there are also lots of times when that person or that patient within the community could be coming to you as more of a holistic provider and get the results they're looking for just as well, if not better, compared to going to other providers. So as we think about ourselves as a community of holistic providers, we're all working towards the same goal of helping to bring more natural type options to the people in our community and to our own patients. I believe that we can accomplish that if more of us were to be doing this functional blood lab testing. So now for a little bit more of a difficult question, if every chiropractic doctor, acupuncture doctor, naturopathic doctor, nutritionist, health coach, dietitian, and so on, if all of these different healthcare providers in your community, if they were to be doing functional blood lab testing, do you think you would become more busy or less busy overall? I think what makes this a difficult question is when you are bringing a new service like this into your office or your practice or into your patient care, the initial thought for a lot of providers is that you want to be the only one in your community offering this because you want to maintain that uniqueness and be offering something special that nobody else is offering. But it is my belief in reality that if most of the holistic providers were offering this type of service, you reach this idea of what can be referred to as a critical mass. You get enough people in your community that change their way of thinking about what it means to go to a holistic provider and what it means to actually have health care that digs in deeper or investigates more deeply into what's causing their symptoms or problems. You kind of reach this idea of critical mass where it becomes the new norm, it becomes the new way of thinking. And when this happens, you now have an entire community of people that are all talking with each other, and this is the kind of care that they not only want, this is the kind of care that they expect. So my point is, don't be concerned if you have other holistic providers in your community that are offering the service. In a way, we're all helping each other out. As more and more people in the community get educated about this kind of a service, it will then become the new norm. It'll become the new expectation of what your patients and the people in your community want to be receiving. And with that, everyone wins. We have a more balanced healthcare system between people selecting the services they can get between medical care and more holistic or natural care. And I believe overall the entire community becomes a healthier community when more providers are offering this functional blood lab testing service. Whenever I start a new project or I'm thinking about adding a new service, I like to first think about what is the end result or the end goal that I want to achieve. I like to start with the end in mind. So I like to put my mind out a year from now, 5 years from now. What does this actually look like? How is it functioning and how is it working within the process of what I'm doing? So I encourage you to think about what is the end goal or the end result that you are looking for by offering a functional blood lab testing service. If you were to project yourself out a year into the future or 5 years into the future, what does this process look like? Is this featured as one of the main services that you are recommending and doing with a lot of the people that you come in contact with? Or is it something that's more in the background and you're doing it more on a limited basis with just a more selective number of people? And when you begin with the end in mind, then you can start to backtrack and think about what are all the steps, what are all the items I need to have in place to get to that end goal of how I want to be taking care of my patients or my clients using this kind of service. Now let's get into the blood lab testing process. Easy, fast, fun, accurate, and profitable. This is everything a blood lab testing process needs to be in order for you to be excited and motivated to do this type of work with your patients and clients. So let's start with the end in mind. The end result of a blood lab testing process is you need a way to do this critical or more functional evaluation of the lab results that will save you time. You need a way to communicate the lab results that's going to be easy and simple and will save you time. You need a way to create recommendations for your patients and clients from those lab results that will also save you time. And you need a system that will help you to do the proper follow-up with your nutrition patients that will also save you time. So this is the whole purpose of the creation of the BLT system. It allows you to do everything faster. Let's start looking at the blood lab testing process with the end result in mind, which will be the blood lab report. You're going to have the opportunity to create several blood lab reports in this series of training videos. So let's work together to create your first blood lab report. And we'll do this one with no product recommendations. We're going to do that in the next training video. So thank you for watching the BLT System basic training video number 2. And in the next video, we will create our first lab report. Thank you.